Now to a health crisis lawmakers say is costing the state billions. There's a push to put mental health funding to better use. Supporters of a bill introduced this session tell WRTV's Amber Grigley it could set the state up with a way to save more lives.
That really rocked my family to our core.
Unimaginable grief for Jody Moser and her family nearly 2 years after her brother's death.
My brother, about a year and a half ago in July of 2021, was having a mental health crisis. He was threatening to commit suicide.
His wife called 911 for help.
An officer arrived. There's no one else in the house. It was just my brother. And within about 10 minutes, my brother was dead.
Jody says although this incident happened in Florida, her brother Adam is still a Hoosier, making Senate Bill 1 personal for her and her family.
We have to start treating mental health from a viewpoint that's reimagined and not like a law enforcement issue, because police officers are not trained, and a lot of police officers and law enforcement officials across the state are firmly behind this bill.
That bill being Senate Bill 1 that was introduced by Senator Michael Crider.
Indiana is trying to move forward in this delivery of services.
Senate Bill 1 would establish a statewide crisis response system to support Hoosiers going through a mental health or substance use situation.
I hope that my colleagues keep in mind that without a robust delivery of services, we're leaving our constituents vulnerable to really bad outcomes.
Saturday, faith and community leaders joined together asking lawmakers to approve all $130 million of funding outlined in the bill so that all Hoosiers have access to 3 things.
So it's a number to call, someone to talk with, and then a safe place to go.
The bill passes Senate Monday.
I cannot applaud this bill enough. It definitely sets the foundation for improvements in our infrastructure.
And is now heading to the House for hearings.
I think that the unanimous support in the Senate is indicative of the pathway that this bill will have in the House. I cannot see resistance in the forecast.
This is a bill about people and about making our communities safe and caring, and helping to make Indiana a state that people want to live in and raise a family and do those things.
Working for you, I'm Amber Grigley, WRTV.
Hearings for Senate Bill 1 in the House will start after the session break in early March.